Hello everyone. Today I want to talk about a massive upgrade that's happening behind the scenes in healthcare. We are going to look at how a technology called graph databases is taking us away from generic one size fits all medicine and moving us towards truly personalized care. So, what's the big problem we are trying to solve today is that our medical data is completely shattered into pieces. Thinking about it, your dentist, your heart doctor, your local clinic, and your smartwatch all have data about you, but those systems don't talk to each other. Because doctors can't see the full web of your genetics, lifestyle, and history, they often have to guess based on average patients. This can lead to wrong diagnosis or dangerous reactions to medications. Limitations of traditional databases. So now you might wonder, why can't computers just fix this? The issue is that the old databases we rely on, which act like giant rigid Excel spreadsheets, aren't built to connect the dots. If a doctor wants to ask a complex question like which patients with the specific gene had a bad reaction to to the specific drugs, traditional database have to do a ton of heavy lifting to match these tables up. It is slow and clunky, and with the explosion of DNA testing and wearable tech, these old systems simply can't keep up. That's why where graph databases like Neo4j come in. Instead of forcing data into stiff tables, a graph databases work exactly like a mind map or a social network. You, the patient, are a dot. Your doctors is a dot. Your medication is a dot. The database simply draws line between the dots to show how they relate. It's incredibly fast because it naturally understands how things are connected without having to search through millions of unrelated rows. To show you just how powerful this is, look at this performance comparison when asking a complex medical question. A traditional database took about 1000 milliseconds to find the answer. The graph database, just 20 milliseconds. That is nearly 50 times faster. In a hospital setting, getting the right answer instantly can quite literally be the difference between life and death. Because graph databases store these relationships natively, they can spot patterns in the blink of an eye. Imagine a doctor is about to prescribe a new medication. Before they even finish typing, the system can instantly check the patient's entire genetic web and flash a real-time alert saying, "Stop! This patient has a rare gene that will make this drug toxic to them." The ripple effects of this are massive. First, it puts safety front and center by stopping medical errors before they happen. Second, it helps pharmaceutical companies discover new drugs much faster by easily mapping out complex genetic pathways. And finally, hospitals save billions of dollars by reducing diagnosis and avoiding wasted treatments. Let's look at a real world success story. LMU Children's Hospital had patients with mysterious rare diseases that nobody could figure out. By using a graph database to connect over 3 billion pieces of DNA data with doctors' notes and lab results, they were able to successfully find the genetic cause for 30% of these kids. This is a massive breakthrough for rare disease. To make this work globally, we just need a standard way to label things. It's as simple as writing a sentence. We have our things like a patient or a drug, and we have our connections like patient has symptom or drug is prescribed to. This simple standardized language allows computers to finally read medical history the way a human would. Because the benefits are so clear, we are seeing an absolute explosion in the healthcare industry adopting this technology. As you can see from the trend here, as we move into 2026 and beyond, knowledge graphs are becoming the gold standards for clinical decision making. To wrap things up, graph databases are doing something incredible. They are taking a mess of scattered, confusing medical data and turning it into clear, actionable knowledge. It's paving the way for a future of healthcare that is faster, safer, and entirely focused on the individual patient. Thank you so much for your time.